Hello, hi, I'm Andrew Davis. I'm a fourth year student. I'm going to go into ophthalmology, and I wanted to share a little bit of ophthalmology with you all. This is designed for those going into primary care or for M1, M2 students to get a little bit of a grasp on ophthalmology to see what it's all about. I think it's a great field, and I hope you'll enjoy these videos. So I briefly wanted to reintroduce the structures of the eye, since it's probably been a while for most of you. In the front of the eye we have the cornea. We have the anterior chamber here filled with aqueous. It's created from the ciliary body that goes into the anterior chamber and then drains through the angle. We have the lens here, of course. We have the sclera, choroid, the retina. And then in the back of the eye we have the fovea, which is where your visual acuity comes into play. And we have the optic disc, and finally the optic nerve here. It runs posteriorly. The optic nerve goes to the chiasm, and then the optic tract is created, which goes to the lateral geniculate. So that's just a brief overview of the structures of the eye, some of the things I'm going to be talking about in the following lectures. Let's get started talking about the history you need to take. This is an abbreviated history, and I hope that on your ophthalmology rotation you'll learn to take a good history and physical for ophthalmologic diseases. In addition to a full history and physical exam, you're going to want to know the patient's age and medical conditions. Has their vision loss gotten better? Has it stayed the same, gotten worse? Is the loss in one eye or both eyes? How bad is the vision loss? Did this occur abruptly over a few hours, days, or weeks? Normal vision before the event? Was there pain associated with the vision loss? Is there weight loss, fatigue, jaw claudication, or tiredness of their jaw when chewing? Is there temporal tenderness? These are all signs of GCA, or giant cell arteritis. It should be suspected in elderly individuals. It's also important to ask about past ocular surgeries, cataract surgeries. Talk about the exam you would want to do for someone who presents with acute vision loss. You'd want to know their visual acuity. You can measure this at a close range and far using an eye chart. You're going to want to know their past visual acuity so you can compare, has this changed? You're going to know their visual fields. You can do this by testing to confrontation, or you can get formal visual fields tested. We're going to want to test their pupillary reactions. Forgive me for that. This should be pupil reactions. We're going to look at the back of their eye, called ophthalmoscopy. We can do this with a direct ophthalmoscope or slit lamp. We're going to want to do a pin light exam to examine the depth of their anterior chamber. Shallow chambers can predispose to acute angle closure glaucoma. This leads to vision loss through corneal edema. And we're going to want to check their pressures, called tonometry. You can use a tono pin or applanation on a slit lamp exam. You might have seen this done with the blue light on the slit lamp exam. It takes a little bit of practice, but it is the best way to measure